Hi, Anne. Welcome to Reboot Room.
Hi.
Thank you for accepting my invitation. It's great to have you here. Reboot Room is talking about all technology, and we bring in experts like you in the region to talk about technology, AI, and all the trends. And we want your insights where the tech is heading. So, again, thank you so much for coming. Now, before I get started, I just want you to give us a short introduction. I think you just moved from Germany to Dubai, isn't it?
Exactly.
And
Exactly.
what made you move from there to here?
Difficult question at the beginning. Thank you.
Before you answer, right
Okay.
now you're working as, could you just give us
Yeah,
some
sure, sure.
insights?
So, I'm interventional cardiologist and working at Medcare Al Safa here in Dubai. And we just moved over from Germany, as you said
Hmm.
correctly. And the decision was not easy, as you can think of. So we moved over as a whole family, like my wife and two kids, and to leave your home country. This should have a reason, yeah. And but I want to work as a doctor, and maybe in an international way. So maybe
Hmm.
like a vibrant city as Dubai is,
No,
and
that's
so
good. That's
yeah.
amazing.
So I was working in Germany for 12 years as a
Okay.
cardiologist, and we decided maybe it's an opportunity to leave because for several reasons, security concerns. So Dubai is the safest city on earth,
It is.
Yeah, it
Yeah.
is. So education, um, seek for adventure for sure. Yeah. So when you and there was the same employer for 12 years, and I decided, okay, maybe it's a good time to move. And the kids are rather small, so we decided now or never. And
Okay.
maybe when I'm 38 years old, and maybe when you're 50, when you're 55, and you didn't make this move at the end of your life, you will say, how would my life have been when I decided to move to Dubai or
Okay.
stay in Germany? So we decided, let's give it a try. And my wife was full of hope, and she felt very insecure in Germany, to be honest. And then we decided, let's go. And we sold our house, we sold our stuff. We have nothing left in Germany beside my parents and the parents of my wife. But um,
Well,
that was
that takes a
yeah.
lot of courage to make
Yes.
this move. Amazing.
Yeah,
And
yeah.
welcome to Dubai. I
Thank
hope
you.
Dubai is treating you best, and
Of
there are a lot
course.
of
Yeah.
places that you can go around and
Yeah.
have a look. So, when you move from Germany to Dubai, have you seen a major difference between healthcare, what healthcare was there and what healthcare is here?
Yeah. Yeah.
How do you see the difference?
Yeah, there are a lot of
Mm.
differences, of course. So one major difference is, for example, insurance concerns. So in Germany, you can do procedures directly when you see the patient in your consultation. Here, when you have a consultation at first, you need to get the approvals from insurance, and sometimes the examination, the procedures you want to have, they are rejected several times in a row, and you cannot understand what is the reason for this rejection at the
Yeah.
end. So you answer every query again, and then nothing happens, and it's still rejected. So this is the one major difference. The pace of medicine is different as well. Yeah.
Hmm.
So and mm, the mean and average age of the patient is totally different. So the population in Germany is rather old, so the mean age is higher than in Dubai, and you see that because you in Germany you run after a disease. You have a lot of patients, and when you open your clinic, for example, they are standing like 50 patients and knocking at your door, and they want to come inside, and you need to wait for an appointment like for 6 months for getting an appointment. And
That's
here,
long.
if you want to see a consultant, if you want to see a specialist, you can do that on the same day, and you book it via your phone. So it's easy and it's digital. And so this is one or even two or three major
Differences,
differences,
right?
of
No,
course.
even I'm surprised the level of medical care what has grown in Dubai is simply amazing. I mean,
Yes.
I don't think any other country match at that level, because even as you rightly mentioned that you can book the appointment immediately, I will go a step further. You can book the appointment within 15 minutes for GP right on the mobile, and there is a video consultation available also.
Yeah.
So imagine the level of care they are providing.
Of course,
So
yeah.
that's amazing, right? Now I know we got acquainted in German Emirates Club, right? And you have been talking about AI, and it's the very hot topic in medical industry as well. Now let's start from the beginning. When did you first realize AI could be more than just a buzzword in the medical? What made you realize that, okay, AI, yes, this is something good? When did you realize that?
So I think it was the situation when I uploaded an echocardiogram, what is an ultrasound of the heart, and I uploaded the images to an AI tool, and I get a so accurate diagnose at the end. So the output was impressive. So even when I compare this with the diagnose of my colleagues, or even on a busy day, maybe I could have missed this like small signs, this little hints they were seen by this AI tool. So imaging, automatic imaging is impressive, yeah. And then I realized it is not just a hype or for fun. So this is something what will change the future in medicine. And this, for example, uploading an echocardiogram, uploading images like X-ray or MRI, CT scans. Remember these times when you need to push these X-rays against the light to see if there is any change, yeah? So this is totally digital now.
Yeah.
So you can easily upload it to any AI model and you get an accurate result. And there are a lot of studies there. They compare the accuracy of this output at the end with in some cases with physicians, an unexperienced physician, and then we see AI can perform even better. And but when you compare AI to a very experienced physician, and you will see they are on average, or even the experienced physician is a little bit better in accuracy. But when then at the end, what in my opinion would be the best, you create a collaboration. So an AI assisted experienced physician.
All right.
This will create the best output for the patient.
Right.
Yeah.
No, but as you rightly mentioned, cardiology, actually, it has so much of data available, isn't it? That AI feeds on data. So the more data you have, the better it performs.
Of course,
and then in cardiology, there are a lot of, I don't know, maybe ECGs, imaging labs. How is AI helping making sense of it all? I mean, I know that you are doing some kind of initiatives where you are working, and are you combining all this information and submitting to AI in order to make sense of it? How is it?
Yeah. So we have some different tools available, and these tools are mostly predictive risk calculators. So we enter patient history, we enter laboratory findings, we enter the ECG, we enter the current blood pressure and symptoms of the patient, like tightness or chest discomfort, shortness of breath. So something one can lead us, what is the end result is the risk for having a heart attack, for example. Yeah. And with all this data, there are a lot of studies. They try to catch what kind of data I need to get. I need to put into this model to have an accurate result. And for example, a tool what we use here in Medcare is this risk calculator for a heart attack. And this is a tool what was invented in Swiss. And it has in total 32 different parameters what we need to add. And then we get the result and the risk calculation of having potentially the risk for a heart attack. And this is comparable to our normal and like baseline examination for ruling out any calcification to the coronary arteries, like a CT scan or a stress echocardiogram.
Okay.
So,
Are these tools being developed by the hospital, or is
yeah.
it being purchased? How does it work? I
Yeah.
mean, so
So
you have a team of data scientists
mhm.
and AI experts who are working along with you?
Yeah, exactly. So
Okay.
yeah, we have this team, but you know the major problem is to bring this into public
Yeah.
and to convince insurances to cover it, because most of these models actually are self pay basis. Yeah,
Okay.
because it is partly covered by insurance for now, but not in total. So you will have a co-payment. Yeah, but with the benefit, for example, in this model, what we use to rule out that there is any risk for a heart attack, you don't have to proceed with a CT scan. So this CT scan will be covered by insurance, but with the CT scan you will get the radiation dose, and you will need some contrast added to your via IV. So, and there's a potential risk for an allergic reaction for sure. So, and it gives us the same accuracy as I do a CT scan. So it is a little investment, but with the benefit that it's more or less non-invasive.
Okay.
Yeah.
That's the good thing, actually, right? If it's non-invasive, it takes less time also, I believe,
Yeah.
right? Because for tests, usually you wait for the approvals, and
Exactly.
it takes someone to run through the reports and then give you. Okay, all right.
Yeah.
Now, talking about these tools, the ones which you mentioned, do you think it would be good to implement these tools in the medical schools, or would it make the new upcoming doctors less experienced during when they are passing out?
Yeah.
What do you feel about this? Should the tools be used in the med schools as well?
Yeah, good question. So for med school doctors, in my opinion, the first and most important learning should be to interpret the output of these models. So they should learn how to read a prompt from ChatGPT, how to translate this result in a patient-friendly way, and how to explain it. Because if you want to gain experience, you need to see a lot of patients, you need to see a lot of reports and results, and you need to see even mistakes at the end. So only rely on an AI model risk calculation, and you will never get 100%. Yeah, so you need to see what happens after. So when this risk calculator gives me the result, there's a 99% risk for a calcification to the coronary artery, I can directly proceed to catheterization, yeah, and implant a stent if necessary. So this is something the med school student they need to learn. They need to see, is the result matching with the final clinical judgment and the final clinical decision of the treating doctor.
So the traditional studies continues, but there is but AI tools should complement in these studies.
Yes.
That is what you are saying.
Yeah,
Okay,
exactly.
all right.
Yeah.
But are these tools are they accurate enough? Like, can AI help to detect the problems before symptoms even appear?
Yeah, so
can
let me give you another example for that. So maybe you know about atrial fibrillation. Atrial fibrillation is an arrhythmia, and it is a quite dangerous arrhythmia because it can create some blood clots to your heart, and these blood clots can result in a stroke. So there are tools available. They scan your ECG. So your ECG, but in a normal rhythm, so in a sinus rhythm, and even in this sinus rhythm, maybe for a human or invisible, undetectable, undetectable. There are some small some hints, in this sinus rhythm, normal rhythm ECG, and this AI tool can detect even before atrial fibrillation appears. And we have some patients where the first diagnosis of atrial fibrillation is the stroke. So if we can avoid happening a stroke, because we know these patients are under risk, for creating atrial fibrillation, we can offer a better monitoring for them, and we can see, do they need anticoagulation therapy, what can avoid building up a clot and creating a major, maybe disabling stroke. So these tools are available already, and as I told you, risk calculation for creating heart failure or getting an heart attack, they are already in use. So
do you think that this is gonna be normal in all the hospitals moving forward in future?
Yeah.
Not maybe now, but in future, would there be a predictive care kind of department, I would say, that you don't have anything as of now, but then you submit your reports and they look for what are the future predictions and all those things. Do you think it is going to catch on?
Yeah, exactly. And the patient is looking for this.
So there is a demand for it.
Yeah, there is a demand, and the patient. I have a lot of patients within the last weeks, because we have this program running since some weeks, and a lot of patients, they are exactly and typically looking out for an AI tool and what can predict their individual risk, and mostly it is prediction. So it is preventive medicine, like what is usual in Dubai. As when I come back to the first question, in Germany it's like running behind, but here is like preventive medicine is perfect, and so I'm upfront, so I can treat diseases earlier in an early stage to catch it up early.
So people are more proactive to know
exactly.
what's happening with their body and what's going on, and I think that's why there is a high utilization of smartwatches, smart wearables, and everything. And because people are in this fast-paced world, that they want to keep themselves healthy. I think so. Yeah, that's good. That's happening. Are there any tools which you are using personally, wearables or anything? Are you using anything?
Yeah. So I use a smartwatch to monitor my heart rate.
Okay. And what do you say on a rating from 1 to 10? Do you think how accurate is that?
On a rating from 1 to 10, I would say it is a solid 7.
Okay.
Solid 7.
All right.
Yeah. So,
helpful.
Yeah, helpful. I have a lot of even young patients. They suffer of the feeling of fast heartbeats, and for me as a physician, it is so hard to detect, to help them because you suffer of this palpitation. So fast heartbeat is called palpitation, and you want to reach out a hospital, or you want to reach out the physician, and when you finally reach the physician, it's gone. So I'm struggling. I'm attaching like this Holter ECG, or even for 7 days, and catching nothing. And the patient is thinks, okay, the doctor has no idea what is my problem. But I think one option could be to wear a smartwatch, and even with the newer models, you have the opportunity to take an ECG on your own. So within the seconds you have the feeling of a palpitation, of a fast heartbeat. You can take your ECG and forward it easily to your cardiologist.
Absolutely.
For example. But it is a technique, and this technique creates for sure artifacts. So I remember sometime we started a telemedicine center in Germany, and I remember sometime I opened up my laptop and
what is telemedicine?
Telemedicine is the opportunity to send, for example, an ECG, for example, to monitor your heart rate from a distance. So the patient was at home, not in a hospital, not in a clinic, and sent his ECG or his current heart rate to a server, and I could check these results. And I opened up my laptop in the morning, and I got 1,000 alerts of one patient. And it's impossible. And I checked all the alerts, and 999 of them were artifacts. So it is oversensitive, and this overwhelms the doctor at the end. So I cannot check 1,000 reports for each and every patient. So we need to create tools that are accurate in diagnostics, and they should reach medical standard, that we can create a reliable diagnosis, at the end. And
yep. Yeah. See, I can see that, it's really fascinating, the type of tools now which are available for normal people like us who are not aware about medical technology. And if we have smart watches, I think there are some watches we can even take our blood pressure as well. It swells up and it takes a proper blood pressure, and then it keeps a record, and it helps when they are visiting for their doctor for the regular checkups and everything.
Exactly.
It's really good where everything is heading, but as you mentioned, that it should reach to a medical standard, but I think to reach the medical standard, more and more usage is required by the people. Only then they can find the anomalies, only then they can find what is fake readings or wrong readings, and then it can be fixed. I think Apple is one of the top technology contender also, who is investing a lot in getting this medical alerts as well. That's good. Now let's talk about your role as a doctor. Do you think that it's changing now? Would it change for everyone else as well? Because there used to be traditional doctors where you take the appointment with the doctor comes in, then recommend some kind of tests or something, and then you wait for another 3 days for the reports to come. How do you think what a future doctor looks like? Does he have to have AI available at every step?
So maybe not at every step, but he should be open to this technique. He should be open to this technique, because even here in Dubai, maybe this is a change because of the lower average age, but here I see there is the demand and the will of the patient, and they want to have an modern and not an old-fashioned doctor. So even let me share one consultation with you. So they were asking about a disease and symptoms. The patient is suffering about 1 year, and they consulted several different doctors, and no one got the correct answer. So they shared all their reports with me, and they are asking my opinion, and I shared my thoughts, and I shared what would be, in my opinion, the next examination. And then the answer was, oh, okay, ChatGPT answers the same. So so I think that the patient, because it's easy, and it is, so even when the patient reaches a dead end, so they were walking or doctor hopping, walking from doctor to doctor, no one can solve the problem. Sure, when you reach this dead end, upload your report to ChatGPT. We all know about the story where a mother uploaded the reports of her son, and after 3 years, ChatGPT solved the problem the 17 doctors couldn't before. So and the patient is checking your answer and comparing your answer to ChatGPT, and so but this is, in my opinion, one problem on the other side as well, because the patient will rely on the answer completely, and this over reliance, even for me as a doctor, this exists. This is called automation bias. So this is a bias what when I offer my further plans for this patient, and this is totally different to what ChatGPT would answer, I think the patient would leave my office, because they trust ChatGPT without knowing the source of the prompt of the data. So maybe the source is weak, but we don't know that. So we should keep an eye on what is the source of data, what creates this prompt Yeah, and yeah.
Was there any time that you overruled ChatGPT? I mean, personally, while talking, and ChatGPT said something after looking at it, and then you said, "No, this is incorrect. It shouldn't be like this."
Yeah.
Did that happen any time?
Yeah, so
it did.
Yeah, it
Okay,
did.
all right.
It did. Yeah, let me share one example. I uploaded my ECG.
Okay.
Yeah? And ChatGPT says, "Okay, your ECG looks like a life-threatening arrhythmia."
All right.
Okay, and I answered, "Okay, but I'm feeling fine. So, but this can change suddenly. Yeah, better call an ambulance or see an ER." I said, "But I don't have any symptoms. Do you really think I have a life-threatening arrhythmia?" Let me check this critically again. Yeah, so most probably. So it is it is a task-driven tool. So the task is to create an answer.
Yeah.
And in this case, the answer was life-threatening arrhythmia. Even I asked several times again and give more options. Yeah. And attempts. And then I answered ChatGPT. But I'm a cardiologist, and I do think it's a normal rhythm because it's my ECG, and I do feel well, so I have no problem at the moment and no symptoms. And then ChatGPT answered, "Okay, but this changes the frame of discussion a lot." Yeah, yeah, this changes a lot. So
it got backtracked.
Yes,
on
and
what he said.
Now, okay, you are a cardiologist. Now you're in the game. We have a normal ECG. Was the answer. So there are some mistakes, and maybe ChatGPT will take a look to whom he is speaking. Yeah. So maybe in the
definitely.
patient. Yeah.
See, the point over there is I have heard this from so many others also in their experts areas as well.
Yeah.
ChatGPT is trained on data. It is trained to guess the next word, right? And it does so confidently that the people who are talking to it or ChatGPT or any other tool, they feel totally convinced.
Yes.
Yeah,
exactly.
more than a human. Also, if a human tried to convince them, they wouldn't be able to get convinced. But when ChatGPT or any of the AI tools says, they get convinced like so easily.
Yeah.
But in past, it usually backfired. So in past, if you see that, I have heard a lot of cases where people went on Google and searched their symptom, and it led them to having some kind of life-threatening disease also, right?
Yeah.
And then they got panicked, they got anxious, they have to come to doctor, and they say that I searched it on Google and this is what I found.
Yeah.
Do you tell your patients that you shouldn't be doing this, or now the game has changed? Do you tell them, okay, it's okay to consult ChatGPT?
Yeah. So for me, it's totally okay to do that. Yeah, because I for myself feel as an experienced doctor, and I will create the same accuracy at least as ChatGPT. And when I use ChatGPT on top, maybe we can have a more accuracy at the end.
Yeah.
But I'm open to this. So I know this funny thing, when you Google your symptoms, you have cancer. Yeah? So
anything would lead to cancer or brain damage or
lupus.
something.
Yeah. It's never lupus.
Definitely.
At the
end.
Yeah. So this for sure. But I'm open to this because the patient will do that. Yeah. They never mind. But in my opinion, it is. When you Google or when you ChatGPT your symptoms, and it creates 99% of cancer, but you need someone who checks again, and who gives reassurance, and who guides the patient at the end. So I'm the one who will do the final clinical judgment. So I will take into account what is the risk calculation. 99% cancer. But when you open up your laptop and it says, or you Google your symptoms and enter it to ChatGPT, 99% cancer, this creates fear, anxiety. And you need someone who translates, this prompt, this result into real life. And does it really match? Are all circumstances taken into account? Is family, surrounding, even the area where you live has an impact. Is all this taken into account, or is it just like 5 symptoms and you have a weak result, and this creates fear at the end? So you need someone who guides you through this path. And even when I share the opinion 99% cancer, I will follow up, and it's not ending by 99% cancer risk. It's ending by, okay, we have this 99% cancer risk now, but these are the next steps we need to do to be sure, and these are the potential treatments, and this is your prognosis. So and this reduces fear and anxiety.
So it's not always the higher the percentage, you just leave it, you don't do that. You have to follow up on that. That's absolutely, and that's the thing which only a human can do. You see,
sure.
I mean, if you upload something and ChatGPT just gives its decision and says that you're gonna die, and just keep things in place and everything, right? So now, to become a doctor, you need to have certain skills, right? All the medical students need to have certain skills. Do you see that there is going to be a change of those skills now? I mean, should there be involved more into technology now? What do you suggest for the people who are?
So technology, they should be open to technology. They should be open to that, and they need to learn communication skills. So this translation process to guide the patient to place the final clinical judgment, this would be or will be the role of the future doctor. And with the assistance, with the help and collaboration of an AI model, because this creates time for the doctor to concentrate more on the things that are human, like physical examination, like clinical judgment. So when I look into the patient, so AI cannot look into your eyes and see your fear or your anxiety, your body language.
Absolutely.
So this is not possible. And for now, maybe this will change in 10 years, but
you never know.
But you never know. You never know. But for now, this is this human touch is irreplaceable.
No, that's true. That's true, and it goes in demand actually. So what's happening in hospitality also? I would like to relate that as well with the medical areas as well. Even in hospitality, we say it's a very people-oriented field, because when you enter a hotel, there is someone to welcome you and all those things, right? But it will go on until only when the guest wants it, because slowly guests are changing as well. They are liking technology more and more. We might reach a certain stage where majority of the people would like to be dependent on the technology. We don't know. Maybe it can happen. So maybe at that point they would be happy if a robot looked at their symptoms and just give
there are some images like robotic doctors doing any surgery.
I have
so
seen
this
actually
is
one of the things, where there is a globe kind of thing, and a patient goes inside and it checks the entire body with some kind of light and lasers, and it says that it gives everything about your health and all. So that's something really huge.
This will happen. Maybe not tomorrow, but maybe next year.
That's where it's heading.
So this is where it's heading. Of course.
Now,
of course.
In the healthcare, it's all about trust, isn't it? Because it's the confidentiality of the patient, because whatever they are sharing with you, how do you convince the patients to trust you with the information which you will be using in the AI? Are you taking consents with the guest, and how does it work?
So I will tell them before we start the consultation that I will use AI, and I need to have like a medical procedure. I need to have their consent, but an informed consent. So I will tell them I will use AI, but this is a tool what can make things visible what are potentially not seen by a human eye. So it is like a tool what creates more accuracy, but at the end it is a clinical judgment done by a human doctor, but the human doctor is assisted by an AI technique. But they always have the opportunity to opt out.
Yeah, that's important.
Yeah.
Right?
So this is important. So to give them an informed consent, to inform them these are the potential benefits. The benefits are your experienced doctor can perform better with an assisted AI model, but there is a risk for failure because it's a new technique, and in some cases we don't know what is the source, as we spoke about already, the source for this prompt, and in that cases there is a potential risk for this automation bias that I, as doctor or the patient itself, over relies on the result. And I come back to this ECG. Imagine a patient I saw in the morning, and we did an ECG, and he said, I have this racing heartbeat, and we did an ECG, and in a moment he took a picture of this and uploads it to ChatGPT and gets this answer, like a life-threatening
right away.
Yeah, so right away, and he calls an ambulance because ChatGPT is suggesting this. And I see this patient in the midday in the ER, it is hard to convince that I'm right and ChatGPT is wrong because they, as you said already, they trust
they trust so much on the technology.
So it is hard to create trust, but on both sides.
Okay.
So I would like to create trust in giving and sharing my experience.
Absolutely.
And but when I have a support of an AI model, this can create even more trust, in my opinion. So when I can tell the patient, I have an accuracy rate of X, but when I use AI, I have an accuracy rate of X plus.
Absolutely.
So
but now in your trials, do you see that people are opting for it? Is it majority opting, or less and less people are opting? How do you see?
I think there are very less people who are opting out. So
still
they are open-minded. We are in Dubai. So they are open-minded. They are open-minded.
What I noticed is when you ask, when you are going out and when you are dealing with some professional, and when they ask you the question about opting in with the AI or not, and they are a little bit hesitant, but back at home, no one cares.
No.
So they just, as you rightly mentioned just now, people can just take a picture, upload it to ChatGPT, which is totally public, whereas your medical tool is private, and it's not open to the world. It's confidential with data privacy laws and everything, and people just upload everything to to ChatGPT also. So the privacy doesn't matter to them. So it's a bit of a game over there also, and slowly we are moving towards that as well. Now, as you mentioned, patients do have right to opt out of using this AI as well. Do you think they feel safer? Why are they opting out? Is it because that they feel that the diagnosis might be incorrect, or what are the reasons, do you think?
So these are more the elderly people, and they trust in the traditional doctor. Experience and this very traditional way. But they fear and this fear is correct, in my opinion. To fear a new technique is not bad, because it makes mistakes, and when it's a mistake that is like not life-threatening, but it even can create life-threatening mistakes. Like when you get the diagnosed 99% of cancer, there is a suicide risk at the end. So you will sell your house, you will sell everything, and at the end you will never have cancer. So there is this fear is, in my opinion, is not bad. And we should discuss this, that the final judgment is human, and this should convince at the end, because when I use AI, it's not about cheating. Yeah, so there's the fear as well. So the doctor has no experience. He uses AI to make my diagnose. Yeah,
Yes.
but that's not the case. Yeah,
Yeah.
so
So AI
it
is
is like
mostly
to
helping you.
yes, to
Yeah.
augment my quality. Yeah,
Absolutely.
yeah,
Because you are not giving final decision just based on AI.
yeah,
You are giving
exactly.
final decision based on your experience, your understanding,
Yeah,
and all the hard, or maybe I would say, imagine if you would have to go through 500 ECG reports for the same patient of the past 10 years.
yeah,
It would take a lot of time for you,
exactly. Yeah,
definitely.
exactly.
And then if you use your well documented approach of AI, which is being created for the special purpose of hospitals, that has more that is more reliable, and definitely you can have some consultation and have this. I think that should build trust over time, and as you rightly mentioned, if the technology is new, people are scared to accept it. Same thing happened with the internet also when it came out, and people with the social media as well, people were very hesitant in the beginning to share anything, but now everyone shares everything, so there is no problem to that. It just catches on. Now, do you see that when AI is helping people at their home, do you see that there is some kind of data problems? Should they be doing or shouldn't they be doing? What do you have to say on that? I mean, using all this public platform available tools, do you have any comment on that?
So we should keep in mind that we don't know where we are sending our data to. Yeah? So if you upload your ECG, better keep in mind that you cut out your name, for example. But in medical reports, sometimes it's not possible. So you should keep in mind that we are not aware of
where the data is going.
where the data is going at the end. So this is something. So data privacy, we need to create rules. We need to create like a standard operating procedures to guide the patient to store their data in a safe way, because I don't want to get like rejected for my insurance company in 10 years because I uploaded an incorrect ECG or something like this now to ChatGPT. So this is something we don't know at the moment, so be patient with this, because this information is
and plus, as I think at some point you have mentioned also that the data is not being trained properly. It doesn't have that kind of variety of data, because most of the data recordings which comes online are from metropolitan cities or somewhere where they have access to submit the reports, but whereas majority of the population don't have that access to submit the reports, which means the data is being trained on only certain nationalities, certain gender, or certain areas. And when and now ChatGPT is in the hands of most of the people, and if they upload their data and ask questions, it might be biased in figuring out things, isn't it?
Exactly. So we don't know what the data is trained on. And most probably it's trained on a young male college student, and this is not the population, not the patient I treat. Mostly. So even ethnicity and even the area where you live has an impact on the health. So this for sure needs to be kept in mind.
So this reliance on wearables, what we are using nowadays, is it a good habit, or is it, or are we being too cautious and we are getting ourselves anxious for no reason? Is it what is your take on it? Like if I am wearing an Apple Watch, every time my heart races, I'm getting panic that, oh my God, something is happening. And if I didn't had Apple Watch, I might just go by my day and finish my day. Do you think, is it good or bad?
Both of this, both of that, both of that, to be honest, because one half of the patient, they are using it only when they have the feeling of racing heartbeat.
Okay.
But I do have patients, they create like 20 ECGs a day and send 20 ECG via mail. And they are driving themselves crazy with this. And they are checking their blood pressure, they are checking their heart rate. And you will imagine when you check your blood pressure every 5 minutes, it will increase. So this is the anxiety you create by yourself. So it's therefore I pledge for keep it serious, be patient. This is a tool what helps us to detect, but please don't over rely on this and don't drive yourself crazy. And but in some cases I have 20 ECGs a day.
All right. No, I know. I mean, like, see, people usually buy Apple Watch not only for the medical reasons. It's more of they keep their steps counting, health tracking, and everything. But then ECG is a part which comes along with it, like it or not. And then once you start checking it, you become habituated to keep on checking it. How much is it, and all those. But it's good that they are being proactive, but then having getting over anxious on it can cause troubles. Now, these AI tools which are now being developed and implemented, do you think that this will be available for all the hospitals across? I mean, can it go cost effective? Because I am sure what you are implementing must be expensive enough, right? And so it means not every hospital can afford it. Do you see in future that the cost should go down and everyone should be benefit?
Absolutely. So in my opinion, this is just the beginning, and we know when you need to scale something, and when you scale something, it becomes cheaper. And for now, we are just starting here in UAE with this AI model, so that's the reason it's expensive for now. But we need to create acceptance for insurances to cover these models. This will reduce the cost for the patient. When we could widespread this over many hospitals, this would create a scalability at the end and reduce the price again. And AI tools, even in the future, I think it is a tool what we will have on our smartphone. So you will pay for the software maybe, but you will not pay for any additional tools. So it is in your pocket, and therefore it is usable even in smaller hospitals, or even in rural or underserved areas. So think about Africa or something like this. So
no, that's a really good point. I never thought about it that way. The tools what you are talking about, even if it's expensive, it can be used via smartphones or anywhere, and they don't have to invest that kind of money, and they can just use it on subscription basis, like medical grade tools which you are using. That's true. The technology is actually helping a lot in medical field. Even talking about some kind of robotics, I have recently seen that the hospitals or the areas which were not very much reachable, physical location and all those things, right? And they managed to do the operation remotely over the network with the robotics having in place, and it's simply amazing.
It works.
Have you ever come across any kind of robotics in your field, live scenario?
So in cardiology it is not used. It is not used in cardiology, but we have this Da Vinci robotic what can do a surgery for prostate cancer. And in prostate cancer it is very, very important to perform a surgery within millimeter. So to serve the nervous structure, to serve the vessels, to avoid that there will be any trouble after the surgery. And this robotic surgery is more accurate as the human hand. And this remote surgery, so this is a development of the army, right? So
Yeah.
when there's an injury on the battlefield, that there's a surgeon sitting in New York and doing the operation on surgery on the battlefield, for
Yeah,
example.
yeah.
So, but even this brings us to the opportunity to create more accuracy and even in the OT. So so this is a technique what is impressive, and when you see this robotic work within the surgeon, and you don't see the surgeon by itself, it is impressive to see that.
Oh, no,
to be
that's
honest.
amazing, to be honest.
Yeah.
The way technology is helping in the medical field is, I think this is one of the critical fields where AI is making a lot of progress. Even it's making in medicine also, finding new medicine, targeted
Exactly.
medicine for cancers, finding cures for different type of cancers also. From what I have heard, what used to take years to develop a medicine can now be developed in days, which is great, which is amazing. Now, is there anything which you have seen after coming to Dubai that people have learned something about medicine which is incorrect and you want them to unlearn that? Is there something that people often tell you and you know it's incorrect? Have you thought of something?
Yeah, for example, AI will replace a doctor.
Would it?
Yeah.
Will it replace?
No.
It won't.
No, it won't.
Okay.
It won't. Yeah. But I think the doctors who are not using AI, they will fall behind maybe, yeah? But
Absolutely.
but a lot of people, they come, okay, maybe in 10 years you will not sitting here anymore, yeah, and the AI is doing your job, yeah. In my opinion, the human touch, the human empathetic way of work is for now, as I said already, irreplaceable. But AI will not replace a doctor, but it will collaborate and it will augment and make the doctor perform better at the end of the day. So this is something I heard here several times. You will be replaced in 10 years, okay. But hopefully not. Let's see what will happen.
No, but I think if a doctor, today's doctor can become a super doctor of tomorrow, actually, with the help of AI. He might be able to do different things also. And if you remember, you have mentioned to me earlier when we met last time as well, that AI is helping in writing down the administrative tasks, diagnosis while you are talking to the guest. I mean, while you are talking to the patient. So you don't have to sit on the computer, isn't it? Is that already implemented?
Yes.
It is. So what does it do? What else?
So it listens to the consultation.
Oh, the conversation with the patient.
Conversation with the patient. And while we are talking, it creates my medical report. So the symptoms of the patient, the current medication of the patient, and even when I opt in, I can do the prescription. So I will tell, let's do a prescription of medicine X. Yeah. So it is a technique what reduces my workload in documentation, what is around 50% of my daily business. Yeah. So when this is done by an AI technique, I can concentrate on things that are crucial. Like,
absolutely,
like the conversation, like eye to eye. So imagine you go to a doctor and the doctor will never look at you because he's only writing to you to his
that happens
computer.
Actually.
This happens.
This happens.
This happens. Yeah.
Frustrating also sometimes.
And I want the doctor to focus me. So this creates trust again. Yeah. So that I feel that my problem is taken seriously, and the doctor will understand my problem and my symptom, because I don't go to a doctor for fun. Yeah. So I have a problem, and I want this problem to be solved at the end. So and I want someone listen to my thoughts, to my symptoms, and to my needs. And when the doctor is only typing in his computer and not only focusing me, but if the system and the AI model is doing this, I can directly focus you, and you feel heard at the end. And
even now, if the doctors who are listening to us, but then if they are not recording, so they might forget number of things what you have told also. So it's both ways as well, right?
Exactly.
And the approach of recording the conversations, it's amazing actually. Nothing can be missed out then.
Yes. exactly.
Okay, all right. That's
sure.
good.
You need to recheck, because
Yeah,
in
absolutely.
some cases, even when the language or something like this, and we have different cultures here, and even then you need to recheck the medical report. Yeah, that's it. Yeah, but even in medication, for sure, there are a lot of medication, they sound the same or very similar. So you need definitely
Need to
before you
recheck.
send the medical
See, I
report, you
think
need to
any
recheck
AI
this.
tool has to be rechecked for
Yeah,
after taking any
exactly.
answer. It's
Yeah.
not only medical. I've come across so many messages also in ChatGPT which it says confidently, but which are not correct as
Yes.
well.
Yeah.
I mean, so definitely it needs to be rechecked. That's the main thing. Now, let me ask you a last question now. Would you trust AI with your life? Like, for an example, if there is something, some life, not with your life, I would say, if there is a situation where there is a life threatening situation
Yeah.
and AI says something, but you know something.
Okay. Yeah.
So, what would you do? I
Okay.
caught you on
Yeah,
this one.
of course, yeah. So, you know, when I only will rely on AI, and this is a report or a prompt, and this leads to the death of the patient.
Okay.
Yeah. So this is nothing I can bear at the end. So, yeah, but it depends on the experience of the doctor. So when you have an unexperienced doctor in an emergency room and he is not aware of the symptom, and you need to react now, maybe it's better to ask AI, because this answer will be more accurate. But if you have an experienced doctor, for example, when I'm in the cath lab and there's a complication, or I need to size for a stent, I need to size for a balloon, and I need to create my plans how to treat any blockage of the coronary vessel, I don't have the time to ask AI at this moment. So because I need to enter the symptoms, I need to send the images.
Yeah.
So I need to act immediately. And for now, this is a decision. It's a human decision based on experience.
Yeah.
Yeah.
No, that's what is happening also. I mean, recently, I have recently heard that even in the airlines, when they are trying to implement AI, the final decision at the time of crash, it's being handed over to AI, because in the moment of this kind of panic, usually emotions take over, right?
Yeah.
They might be fearful of taking a wrong decision. They might be scared of what's happening.
Yeah.
So they might not take a proper decision also. So that point, AI can help, and that's what is happening in airline industry also. Well, Jan, it was amazing to have you at Reboot Room. Thank you so much for coming. It was very nice catching up with you. Thank you so much.
Thank you so much for having me.